Hey everyone, Nate here, Hill and Ponton's video guy. Today I'm with attorney Melanie Williams and we're going to be talking about migraine headaches. But before we do, make sure you subscribe and hit that thumbs up button. We would love to reach as many veterans as possible with this information. Now, without further ado, it's time for us to jump into talking about migraine headaches. How you doing today?
Hello, I'm great, thank you. And yourself?
Doing pretty well, doing pretty
Good.
well. So today we're just going to do a quick little dive on migraine headaches. So what exactly are migraine headaches?
So migraines is one of those conditions that affects so many veterans, and it varies depending on each person and what it looks like and the ways it can affect them. The VA would recognize headaches in general, different types of headaches, and migraines specifically. What they're looking at is how debilitating it is, how severe and how often you're getting those migraines, and there are different symptoms that come with migraines. So a lot of times veterans may have light sensitivity, noise sensitivity, in addition to that severe pain. The pain can be in different areas of the head. Sometimes veterans have vomiting with their migraines. But the main thing that the VA is looking at is the way that they describe their criteria is they use a word called prostrating, which basically means that you have to lie down and are unable to function because of these migraines.
So the level of severity is how they define what each rating will be.
Exactly,
Okay.
yes. So they will assign either a 0%, 10%, 30%, or 50%. 0% just basically the criteria is with less frequent attacks. So it probably makes more sense to start with the 50% and then work our way down.
Okay.
So with a 50% rating, again, they use that word prostrating, and they say it has to be completely prostrating, meaning you're out for the count, basically. You cannot function. And most of veterans will talk about how, they have to lie down in a dark room, in a quiet room. They have to, close all the blinds, close their eyes, try to sleep, put something cold, a cold compress over their head, and they basically are out for hours. And it has to be very frequent attacks. That's the word that, the criteria that they use. So there isn't really, an indication of how often it needs to be. We're just looking at very frequent. So you want to make sure that you talk about, when you go to a CMP exam, when you talk to your doctor, how often does this happen? And the way that they look at how much it affects your life is this term that they use, economic inadaptability, meaning it's affecting your work, it's affecting your job and how much money you make and how much you're able to produce. Because if you're having these headaches where you are unable to function multiple times a week, then you are missing work a lot, and so usually that's an indicator that you're not able to work. These migraines are, preventing you from maintaining your job and supporting yourself because of how often they happen. A 30% and 10% is really, again, they use that word prostrating, and it's just a matter of how often it happens. So if it's at least once a month or so, that's going to be a 30% rating. If it's once every few months, that's going to be a 10% rating. And headaches is one of those things that it's completely subjective. Only you know what you feel, what you experience. So it's really going to be up to you to advocate for yourself, not only in the CMP exam, but when you go to get treatment with your doctor, because, the VA is going to look at your treatment records, and it's going to be a lot easier to prove how severe these are if you're always talking to your doctor about it, if you're trying to get, medication, trying to get prescribed something. Not that the VA, will use prescription to rate you,
Yeah.
but it's the fact that you are complaining about it and describing how much it affects your life.
And so this isn't a presumptive condition either.
It is not a presumptive condition. If your headache started in service, you'll want to show that you complained about it in service. But usually the way that I see headache service connected the most is as a secondary condition.
Okay.
So migraines can be caused by tinnitus, even depression or PTSD, a mental health condition, can cause migraines. So it's usually a condition that comes from, stems from a different diagnosis. So if you already have that service connected, that would be, a straightforward way, as long as you're able to provide that nexus link between the condition and the migraines.
And you had mentioned earlier about the term you used, financial
Economic inadaptability.
economic inadaptability, and that can usually be a pathway to TDIU or unemployability as well.
It can, yes, exactly. And a migraine service connected, that would get you a 50% rating. So that alone would not qualify you for individual unemployability. But keep in mind, there's also extra scheduler consideration. So if your condition does prevent you from working, even though you don't meet those percentage requirements for IU, the VA can still grant IU. It's through a process, again, called extra scheduler consideration, where they would have to send your case over to the Director of Compensation Services to determine if your condition is severe enough to warrant unemployability. So, even though it is harder to prove, I have seen it happen because, again, a lot of times these migraines are severe enough. That term, economic inadaptability, means that you're having a hard time maintaining employment and providing for yourself because of these migraines. So you definitely want to consider and advocate for yourself that, if these migraines are severe enough, you should also be entitled to IU.
So it can be something bigger than just the 50% rating if that's something that you're at, but it is all about making sure that you understand that that is a path that is there for you after you've gotten service connected with migraine headaches.
Exactly. Yes, yes. And the VA, the regional office, as they are evaluating your condition, they may not consider it. So you want to make sure that you add that in there, include that VA form 8940 that, means that they have to consider TDIU. So yes, definitely advocate for yourself in the CMP exam, speak up and talk about how it affects your ability to maintain employment, because yes, that could lead to individual unemployability.
Awesome. Thank you so much. So yeah, make sure that you advocate for yourself if that is something that you are going through, migraine headaches. Thank you so much for watching. If you have any more questions on this, the link to the article is in the description below. Please share with anyone you think might need this information. Have a wonderful day.